Respiratory illnesses were high heading into the holidays, and doctors were bracing for cases to surge even more after those holiday gatherings.
It was frightening. I was talking to a lot of different family and friends in the neighborhood, and it just seemed like to be spreading like crazy. So the question is, for the situation at local hospitals and doctors' offices, what is going to be done? We turn to our own ER doctor, Frank McGeorge, to show us exactly what's going around. It's not a technical term, but it's kind of a hot mess.
Kind of is, Pam and Karen. You know, to no one's surprise, respiratory illnesses remain very high this week. The numbers vary from hospital to hospital, but many are reporting an increase in flu, COVID, or both. Karen's hot mess. Here's what's going around where you live.
In Wayne County, doctors at Ascension St. John are seeing flu, COVID, and pneumonia. ER Dr. Joseph Schramsky at Corewell Health Dearborn says they're seeing an uptick in COVID and RSV following the holidays. The CVS Miniclinics report some cases of impetigo. That's a contagious skin infection that causes red sores, particularly around the nose and mouth. Moving to Oakland County, Dr. David Donaldson in the ER at Corewell Health Beaumont Troy says they're seeing tons of influenza, plus cases of COVID and RSV. Trinity Health Oakland reports an increase in flu and COVID. The CVS Miniclinics are treating lots of flu and ear infections and say strep throat is on the rise too. Looking at Washtenaw County, Dr. Marissa Louie at Michigan Medicine reports children suffering from COVID, flu, and some RSV. They're also seeing an increase in cases of infectious diarrhea, with some kids testing positive for norovirus. On the adult side, it's the same list, with many patients also suffering from various gastrointestinal illnesses. Heading to Monroe County, ER Dr. Spencer Johnson at ProMedica Monroe Regional says influenza, RSV, and other respiratory infections remain high, but seem to be stabilizing in numbers. These illnesses are especially impacting very young and elderly patients. Finally, in Macomb County, Dr. Stanley Materka in the ER at McLaren Macomb says flu is still the most common illness they're seeing. Cases of COVID are rising, but mostly mild, and stomach viruses remain high. The CVS Miniclinics are treating a number of sinus infections and seeing a lot of pink eye at all of their clinics.
Now, with the increase in norovirus specifically and stomach viruses in general, I really want to stress the value of washing your hands frequently. It's also important to stay home if you're suffering symptoms of a stomach virus, really to help prevent spread to other people.
Yeah. Now, it seemed like the statistics before, Michigan was doing pretty good in terms of the flu. It seemed like other states were worse. So how are we doing now? Because it doesn't seem pretty good.
Sadly, we are catching up, actually. So Michigan right now is reporting a high number of cases, but that is actually still below several states that are very high in terms of flu activity, and unfortunately that basically means we probably have a lot of flu season left to go, so it's probably still a really worthwhile thing to get a flu shot if you're really late to the party.
Yeah, I know. Your family got hit.
2 weeks before Christmas, my kids are still coughing in the middle of the night, so it's been tough. Whatever's out there.
Bad respiratory season.
Yeah.
Keep washing the hands.
Thank you, Doc.
Thank you, Doc.